There is a talk about the silicone mold. It is made to look like the silicone mold is the answer for everything. The silicone mold really costs not more than 200 rubles, and it's really not a big deal. The only important thing when you use the mold, you need a very, very good follow-up with a good ENT doctor who can look into your ears through the microscope. Very, very important. This is the silicone mold in place, which we will leave for 2 months or 3 months. This is again the mold in place, keeping the doorway nice and wide open. The skin graft is really, again, not a big deal. There's a standard instrument and a standard skin graft to be taken. This is another case where we first did the atresia and hearing surgery before we did the microtia repair in 2 different settings. This is important, very important. We use a lot of local vascular flaps to make sure that the skin healing is good. Show you, it's important. We've been doing this for 30 years now, surgeries, and we've devised many techniques. This is the surgery of stapes surgery, where we use a special piston prosthesis, and in such patients we give 100% normal hearing. This is the photograph of the stapes suprastructure that was removed from the patient. This is how tiny the stapes is. For the next 2 or 3 minutes, I need your special attention over the next few slides. There is this door we spoke about, there is the passage, and there is the drum. In atresia patients, all of these are absent. In some patients, in most patients, many patients that we deal with other diseases, particularly a condition called as otosclerosis, what happens in these patients? They have a normal ear, they have a normal opening, the door is normal, the canal is normal, the ear drum is normal, the malleus, incus and stapes, they are normal in size and shape, but the stapes is fixed, it cannot move. And this patient has a hearing loss almost as much as our atresia patients. What does this mean? Even if you have a canal, even if you have a drum, if the ossicular chain, and more importantly, if the stapes is not able to move, your child cannot get good hearing. The role of the CT scan is very important. So stapes fixation, piston operation, 100% hearing, no problem. Just a big hole, no guarantee of hearing. So the size of the hole, just the hole, no use. Like the stapes, the malleus and incus can also have problem. There are many prostheses that we can use, but we prefer to use the cartilage for reconstructing the hearing chain because it gets lifelong stability. This is a post-operative cartilage picture. This is a prosthesis that was used after many years. Nice wide eardrum, beautiful prosthesis in contact with the eardrum. A few words about cholesteatoma. There is a lot of fear about this. You get a foul-smelling discharge in cholesteatoma, and cholesteatoma really is of 3 different types. Just using the word cholesteatoma and throwing it on the parent's heart is very unfair. Foul-smelling discharge coming again and again, not responding to medical line of treatment. There is a not dangerous type. There's a cholesteatoma of the canal, the external canal, which is very safe. So if the door is narrow but the corridor is wide, this is not really so dangerous. This doesn't go to the brain. There is another type which can erode, but these are very rare. And the surgery for cholesteatoma is again a very standard routine surgery. There's nothing special about this surgery. A CT scan cannot diagnose a cholesteatoma. You may suspect, but you can't diagnose. The atresia patient is actually protected from the dangerous type of cholesteatoma in majority of the cases. It's very rare in children.